One, the chronic sinus infection is usually it can start out viral and convert to bacteria because the mucus in the sinus cavities is normally sterile, but it's a perfect growth medium for bacteria that are always in those areas. So if the bacteria overgrows and the mucus changes from clear or light yellow to dark yellow, if it thickens up instead of being thin and watery, if it's dark green or brown, then you got a real problem. That indicates various types of bacterial pathogens, and that means you will need to be treated with antibiotics. The problem with sinus infections is difficult to get the antibiotics into the sinuses, so you have to take the antibiotics for a longer period of time, which means you possibly will get GI upset, or for women, vaginal yeast infections. So be prepared to take a diflucan or something to stop you from getting the vaginal yeast, and to protect your stomach with probiotics or eating Greek style yogurt during the treatment protocol. That may be 15 days, it may be 30 days. If you have a combination of allergy and obstruction, it's going to be very difficult to get your sinus infection under control. You're going to have to partner with your primary care doctor or your ENT, ear, nose, and throat specialist, to obtain some relief. I found that one of the things that is easily obtainable over the counter, can give you great relief, is a nasal lavage unit. It's 40, 50 bucks at most drugstores. It washes the sinuses out. It doesn't sting, doesn't hurt, doesn't burn, but it flushes out that infected mucus, and it doesn't cause you any real problems. There's no such thing as overusing it. You could literally use it every day if you needed to, but particularly if you have that kind of congestion, then a nasal spray such as Flonase, a non-sedating antihistamine such as Zysol, Claritin, Zyrtec, or Allegra, all of those things. But if that mucus is colored the way that I describe it, that definitely confirms bacterial infection, and you're going to need a course of antibiotics to eradicate it.